Hi, my name is Dr. Raymond Benedetto, and I want to thank you for taking the time today to watch this video. It's going to be very informative. It'll be well worth your time. So thanks for taking the time. Again, some of you may be watching this on DVD, some on the internet, some on our website or YouTube. We're going to go through a lot of information today in a relatively short period of time. So just need you for about the next maybe 20 to 30 minutes or so. We're going to go through some valuable information though. So I advise you grab a pen and a piece of paper. You can take plenty of notes. If you have questions or comments or concerns, or you'd like to come see us for some help, I'll give you our contact information later on when we're all done. But for now, let's go ahead and dive right in. Again, thanks for taking the time. We are talking about fibromyalgia and chronic fatigue syndrome today, and all things related. You're probably watching because maybe either you or a loved one or someone may have this or suspect they have this. Again, we're going to give you a lot of good information today and see if we can help you out. So again, we're talking about fibromyalgia and chronic fatigue syndrome. Again, who am I? Dr. Raymond Benedetto, practicing here in Bethlehem, Pennsylvania for over 10 years now. I am a board-certified chiropractic neurologist. We've been seeing fibromyalgia and fatigue patients for probably 8-9 years now, most of that time. I'm a charter member of the International Association of Functional Neurology and Rehabilitation. I've also studied extensively, and I'm good friends with Dr. Michael L. Johnson. You can look him up if you like to. He practices up in Appleton, Wisconsin. He's a mentor of mine. He wrote the book, What Do You Do When the Medications Don't Work? Non-Drug Treatment for Chronic Conditions, including Fibromyalgia. Now, big picture-wise, let's start here. All chronic health conditions, fibromyalgia and fatigue being one of them, have some common threads. Okay? So whether we're talking about fibromyalgia there at the top, or irritable bowel syndrome, diabetes, thyroid conditions, peripheral neuropathy, autoimmune conditions, they all have two basic causes. Okay? We have metabolic imbalances, so something's wrong with our metabolism. And that there could be many other things under that umbrella that we look at. Things like anemia, thyroid problems, blood sugar issues, autoimmune disease, food sensitivities. These are things that we look at with all of our patients to figure out what's contributing to their fibromyalgia for them. And we have neurological imbalances. Something in my brain's not working right, especially with fibromyalgia and chronic fatigue. My brain's not processing pain the right way because I got all this pain, but I didn't hurt myself. I shouldn't have pain in those areas. I also will get decrease in firing in the brain, which will cause a lot of fatigue, obviously with chronic fatigue syndrome. Let's talk about our metabolism in its simplest forms. Okay, you eat food. You should be eating, obviously, a good, healthy diet, which we'll get to and we help our patients with. You have to eat food, and your body needs to convert it to energy for our body to use. That's it. That's basically it. Now, all this energy has to go to the different systems in our body to use them. About 30% of that energy that our body makes, that our food is converted into, goes to one system. And a little question here, which one do you think it is? Is it the endocrine system, digestive, the nervous system, immune system, or the cardiovascular system? Good question, right? It's our nervous system. 30% of all the food that we eat that gets converted into energy goes to our nervous system. Okay? If you have a metabolic problem that's hampering that energy conversion, your brain is not going to work right. Okay? It's the most metabolically active organ that we have. So we need to look at patients' brains all the time, especially fibromyalgia patients. So all cases, again, fibromyalgia and chronic fatigue are no different. We need to look, they're a combination of neurological causes, metabolic causes. We need to evaluate both of those areas and then help for that particular patient fix the parts that are broken in those areas. Your nervous system obviously consists of your brain, spinal cord, and nerves. Okay, your brain, central computer, runs the show. Okay, the nerves are the wires that communicate things to the brain and out from the brain. Okay, each cell is dependent on those signals to stay alive and to stay healthy. Okay, our brain needs to communicate with all of them. So our brain-body connection. Your brain is a sensory organ. Okay, with things like fibromyalgia and chronic fatigue, that it's not working right because we're sensing things that aren't there. Okay, why do I have pain here when I didn't hurt myself? Your body's one big receptor. Okay, it's looking at all this information from our environment and from our body sending it to our brain for processing. Okay? So your brain, to stay alive, needs constant input, needs stimulation all the time. Okay? And we have receptors all over our body. Think about the muscles, sense gravity pulling, and our skin, touch, eyes, ears, nose, all these things that send all this information to the brain. There are two in particular that stimulate the brain the most. Okay? And they are touch, so touch, and gravity. Gravity is always pulling down on us. I mean, our entire lives. From the minute we're born, actually even when we're not born, gravity's pulling down on us. Okay? Quick anatomy lesson. We'll keep this relatively simple. There are three main parts to our brain. So we'll go over the different parts and we'll show you how when they're not working right, it can lead to things like fibromyalgia and chronic fatigue. Okay? We have what's known as our cerebellum. It sits in the back. Controls postural movement, coordination of muscular contraction, eye movements with spine. Okay, we have what most people think of as the brain, the cerebrum of the brain. And then we have what's called the brain stem. Here's how the brain works. Okay? Sensory input comes in to our body, from our world or from our body. Okay, touch, for instance. That information from that side, so say it's coming from our left, goes to our left cerebellum. Okay? That is processed and then sent up to the brain. Okay, the cerebrum. So, and it crosses over though. The left cerebellum is going to send all that information to the right brain. Then the brain is going to process that information, and now there's output. So it's going to fire back down. So we go from the cerebellum to the brain, and then from the brain back down to the brain stem. Okay, so the brain does a large part of what it does is firing down to that brain stem to regulate it, to kind of keep an eye on it. And without this, then that upper brain stem is allowed to overfire. Okay, it kind of goes wild. Now, when that happens, what are some of the symptoms we get? These are going to sound familiar because this is a big problem with fibromyalgia patients. Chronic pain, chronic fatigue, irritable bowel syndrome, chronic urinary tract infections, migraine and tension headaches, adrenal gland overstimulation, sleep difficulties, okay? Blurred vision, so vision problems, difficulty sleeping, either falling asleep or staying asleep, dizziness, heart palpitations, sensitivity to light and sound, okay? What happens if we get the part of our brain, the cerebellum, that gets tired, it gets fatigued, it gets weak, okay? We're going to have balance issues, dizziness, vertigo, okay, clumsiness. What happens if the brain, the top, the cerebrum of our brain, he doesn't do his job in regulating the brain stem, so we'll get overfiring in the brain stem, obviously, but we'll also see some of your higher functioning parts of your brain suffer. So we'll see depression, anxiety, difficulty reading. I can't concentrate. I have to read the same paragraph 10 times in order just to try and comprehend it. Difficulty with expressing ourselves and memory problems and lack of focus and concentration. Sounds familiar, right? Altered sensation, numbness, tingling. I didn't hurt my foot. Why is it all numb and tingly? Changes in behavior. So impulsiveness and lack of motivation. We see this, social disorders, ADHD, all these kind of things when the brain's not working right. Again, sounds pretty familiar with fibromyalgia, chronic fatigue. So we get this overfiring in the upper part of the brainstem. What else can happen? Okay, we get stimulation down the spinal cord to the adrenal glands. Okay, you probably heard of these by now. These are our stress glands. These glands release cortisol. They release things called catecholamines, which are inflammatory chemicals. So they cause inflammation to the nerve endings, and they overstimulate the nerve endings in our body that sense pain. So again, we end up with chronic pain, fibromyalgia, sleep loss, all that kind of stuff. Okay, same thing we see here. We get a reversal. So this part of our brain, this brainstem, helps to control our daily rhythms, when we're supposed to be awake and when we're supposed to be asleep. We'll get if this part's overfiring, we'll get a reversal of that. So it should be firing at its highest in the middle of the day, 2, 3 o'clock in the afternoon. Should be at its lowest at 3 a.m. at nighttime. We get a reversal of that. So now it's firing really high at 3 a.m. So I can't fall asleep, I get insomnia, or if I do, I'm waking up and then I can't get back to sleep, like 3 a.m. every morning. Same thing. Now where it should be highest, it's at its lowest, which is in the mid-afternoon, 2 or 3 o'clock. I'm fatigued all the time. I got to lay down and take a nap if I'm going to make it through the rest of the day. Emotional stressors too, obviously. You know, what's going to happen is that puts a lot of stress on the brain, which is going to overfire the endocrine system, the pituitary gland, the adrenal glands. That's very toxic to our brain when all these cortisol and all these adrenal hormones are in the bloodstream all the time. Cause things like memory loss, difficulty concentrating, fibrofog. You've heard these terms. These are the reasons why this happens. And we've got to figure out for the individual patient, for you, which one of these is at play. Are all of these at play? Okay. Another common thing with symptom with fibromyalgia, chronic fatigue, headaches, right? Migraines, same thing. That upper brainstem's overfiring causes rapid dilation and constriction in the blood vessels in our brain, okay, which irritates the nerves, can trigger migraines. How does all this happen? Okay, how did I get like this? Different stresses to the brain, to the body, whether it be chemical or physical, emotional, all causes the brain to fatigue, can cause damage, can cause inflammation. What are some of these stresses, these chemical, physical stresses to the brain? Anemia. If I got anemia, I can't get enough oxygen to my brain. Blood sugar. How's my blood sugar? You know, is it balanced? Am I getting enough fuel to my brain? Food sensitivities. They can cause inflammation. Can cause autoimmune conditions. Poor diet, causing a lot of inflammation. Drugs, prescription drugs, of course. Different infections. These are all metabolic problems that can create problems in your brain and your nervous system, which then lead to the fibromyalgia and chronic fatigue syndrome. What are some of the emotional stressors, right? None of us are immune to that. We all get emotional stressors in our life. It's how our body can handle them. And that can lead to adrenal gland problems if you're not doing well with it. So we have cortisol imbalances, we get a lot of insulin and blood sugar problems, which again is going to further the breakdown of the nerves and brain tissue. Chronic conditions like fibromyalgia, chronic fatigue, do not get better on their own. There's no magic pill you can take, and you're not magically going to wake up one day and be better. We have to fix these problems. The longer you have a chronic condition like this, the faster your brain dies. Okay? This is from the Journal of Neuroscience. Okay? The longer an individual has had fibromyalgia, the greater the gray matter loss. So gray matter is part of our brain. So with each year of fibromyalgia being equivalent to 9.5 times the loss in normal aging. So you're going to be your brain is going to age and die 9 times faster with each year. Pretty significant. How is what we do different? We do things called brain-based therapy. What is that? How is it different? Okay. Based on the concept of neuroplasticity. So by taking areas of your brain that aren't working so well and stimulating them and getting them working again, we can actually rewire your brain. We can stop this process and help get it working better. Key points on this, okay? Your brain changes all the time, and your brain will change in proportion to the stimulation it's given, okay? Different types of stimulation will have different effects on different parts of your brain, obviously. A couple of parts of your brain, in particular, the cerebellum and the cerebrum of the brain, the cortex of the brain, in order to work right, so before we can do any stimulation to the brain to fix it, we need to make sure that it has fuel, right? So if we want to get in a car and we want to drive, before we can step on the gas pedal and steer the car where we want it to go, there has to be gas in the tank. So our brain needs those things. It needs fuel. It needs good oxygen and glucose, sugar. That's what it burns for energy. And it needs activation. It needs stimulation, proper stimulation. So what do we do to do those things, okay? With the therapies that we use to help fix the brain, to help get you better. Okay, we use oxygen therapy here in the office combined with specific brain exercises and activities based on your particular exam. So we do exam, okay, here's what's wrong, here's what we're going to do to fix it. We use things like oxygen concentrators here in the office. Really want to get good oxygen to that brain so that when we step on that gas pedal and steer it where we want it to go, it's able to do that. It's able to respond. Some other therapies we use, different stimulation to the joints in your spine and your body really. We may be doing some muscle retraining. We may be doing smell therapy. We do things like eye exercises or auditory stimulation, so different sounds. We may have you wear special glasses, you know, to stimulate your visual system, different puzzles, whatever we need to do. The parts of the brain that aren't working right, we do the therapies and the stimulation that part of the brain handles so we can get it working better within what you can tolerate. So some metabolic disorders that can cause brain imbalances, obviously. We talked about some of these: anemia, blood sugar imbalances, food sensitivities, thyroid dysfunction, you know, infections. How do you know if you have these? Okay, you've probably never been tested for these. How do you know? How do we know? How do I know? How do I know which of these is affecting you, or are all of them affecting you? We got to test. Proper testing. You've probably never had it done. Okay, you've probably been told your lab tests are normal. We've done a couple rounds of testing. Your lab tests are normal. We can't find a reason for your problem. You got fibromyalgia, chronic fatigue. Have a nice day. Live with it. Okay? Here's the problem. When we look at these lab values, they're based on these giant broad ranges. Okay? You have to be half dead sometimes to fall outside of these ranges. We want to pick up on these things sooner rather than later so we can find a reason for what's causing the problem and fix it. Okay? So traditionally, here's why your test would be normal and you're still sick. Okay? Here's a nice functional range. Here's where healthy people are. Their values are on these lab tests. Okay? In order to show a positive on a test and for your doctor to even consider doing anything about it, you got to be way out here or way out here. Well, this green area here is where a lot of people live. It's where a lot of their values end up being. No doc's going to do anything to you, and you may stay in that range forever. Nobody can figure out what's wrong with you, and you got fibromyalgia, and just live with it. Okay? For example, let's take glucose, blood sugar. Functional range, we want to see it between 85 and 100. Lab value, 65 is low, 110 is high. Okay, you're 126, you're diabetic. So if you fall in that range, you're going to be normal. Yet if I would see you and say you're 73, I'm going to say you got some hypoglycemia going on, or you're 105. You got some blood sugar problems going on. Same thing with other tests like TSH and cholesterols and all that kind of stuff. So what do? What are our metabolic treatments that we do with patients? This is the one major reason that we're getting chronic patients better in our clinic here, is we're simply running the necessary tests to get an appropriate diagnosis. And then once you have those test results, knowing what to do with them. So it's vastly different than what you've probably gotten from your HMO or from your family doc. So you got to ask yourself, how long have I been going to this doctor and why am I still suffering? Why am I still going to this doctor if they're not helping me? So based on a patient's history, based on your history, we run a variety of tests looking at these functional values. We may do blood tests, salivary testing, we do hormones with saliva. Stool testing, we look at things like food sensitivities and how is my digestion working. Probably most of you sitting there right now going, yeah, I got all kinds of IBS and heartburn or what have you. We also do things, advanced lab testing from a lab called Cyrex. We look at food sensitivities and we look at autoimmune disease and things like that. How many of these tests have you had performed? My guess is none. That's the reason you're watching this video. That's the reason why we're helping people. We have these neurological issues, these metabolic issues. All the pieces are spread out on the table. We've got to start putting the puzzle together. Okay, we got to figure out, okay, on the metabolic side and the neurological side, what is at play for you? What's causing your problem? And that's only going to come through thorough analysis, doing proper testing, doing proper exams, figuring out what the cause of the problem is, and getting to work on it so that we can put you back together again, treat the whole person. So what's next? If you're interested, you can come in and have a consultation with me. We'll sit down, we do 2 visits. Okay? What we do is, the first visit, complete case history. You and I will sit down, we'll go over everything from birth till now if we have to. Okay, review everything that's going on with your condition. We'll look at your previous testing if you had it done. Fill out different assessment forms. Spouse or significant others should be here with you. Okay, we're all pulling on the same rope here. We're all a team. We need to all be working together. If I think we can help you after the first visit, we'll do a second visit, where if I accept the case, we'll review everything that we talked about, okay, here's what we need to do to get you well. Here's testing that needs to be done. Here's treatments that need to be done. Here's how long we think this will take. Are there any financial obligations for care? All that kind of stuff. Again, spouse or significant other should be there. If they're on board here, they're on our team, they need to be there. So here's my offer. I only take a handful of fibromyalgia chronic fatigue patients every month. A handful, 5, usually. First 2 visits usually cost upwards of $450 for us to do all that stuff. If you want to make an appointment after watching this video, because you're watching this video or you've been referred to our office or what have you, those first 2 visits are complimentary. I'm not going to charge you for anything. Okay, it's just to see if we can help and then see what we got to do. 3 rules to accept your case. Okay, you have to be willing to make some life changes. The reason why you are the way you are right now is probably because there's things that are wrong. We have to figure out what they are, and it's going to involve changes. You know, we may be making dietary changes and having to come in for treatment, things like that. Have to take accountability for your health. I can't do this for you. I can't want it more than you do. Okay, we're going to have to make changes, and you are going to have to take responsibility for your health. There's a chance that insurance and/or Medicare may only pay a small portion of this treatment or none at all. We'll check when you come in. We have made our care plans affordable so that the majority of patients who see us can get the care that they need and make it affordable, even if we have to do things like monthly payment plans. A couple things we need to think about in closing. How serious is this? How has this affected your life? If you don't do anything about your condition, fibromyalgia, what's life going to be like in 3 years, 4 years, 7 years? And due to time constraints, I can only take a handful of patients. So we only take the ones that are committed and that are ready to get their life back. I want to thank you for your time. I hope it's been worth it for you. If you have questions following this presentation, email benedettochiropractic@gmail.com. Phone number 610-974-9911. We'd be happy to help if you want to come in for a consultation. Again, no charge. See if we can help you out. Email, phone, 610-974-9911. Thanks for listening. Hope it's been helpful, and have a great day.